We have the biggest opportunity in a generation for the most radical overhaul in the way health and social care services in Birmingham and Solihull are designed and delivered, with decisions made as locally as possible, being clinically and professionally led, and with the community rooted in the decision-making process.
We have 80,000 fantastic people working in health and social care services that are ready for change. But the scale of the challenges that we face means we have to work very differently if we're to get services to where our communities want and need them to be. From funding neighbourhood level innovations through to contracting with providers based on the outcomes they will achieve, we are hardwiring integrated care and tackling inequality in every decision that will be taken in the health and care system for Birmingham and Solihull.
Like elsewhere in the NHS, we have to tackle waiting times too, but we also recognise there's so much more that we can do. That's why we've set up the Fairer Futures Fund, to drive local innovations and bring about the change our communities need without delay.
Throughout 2022, we will engage with our communities, health and social care professionals, NHS organisations, the voluntary and community sector, and local and national government to develop a plan for the future of health and social care and support the broader social and economic development of Birmingham and Solihull.
4 very simple principles will underpin every decision that we'll take going forward. And the first is ensuring that decision making happens as locally as possible.
We'll be making sure clinicians and social care professionals are at the forefront of how services are designed and delivered in the future.
We will prioritise supporting innovations that have the potential to transform care, whether they're small or large scale, at a ward or neighbourhood level or partnership wide.
We want to do more than listen to our communities and patients. We need to understand their different perspectives and work together to ensure that our whole system is designed and governed to support changes and improvements that are important to them.
Having just 2 local authorities and 6 NHS organisations in our partnership means we will be able to get agreements on shared priorities quickly and efficiently. And we already have 33 well-developed primary care networks that are perfectly equipped to best understand and drive change.
We will set clear outcomes for every pound spent to improve health and well-being with a relentless focus on value and productivity.
Integrated decision making will be the norm, not the exception, with every issue that requires an integrated solution properly resourced and underpinned by investment, contracts and governance to ensure it gets delivered.
We'll invest in innovation and technology to build on recent successes, ensuring investment and education are available to deliver this at pace and support better outcomes.
Throughout the last 2 years, there's been almost constant dialogue between health and social care and the public. This hasn't just helped to save lives, it's created a new bond and strengthened the trust between the community and service providers, with an expectation of greater engagement in future decision making.
12% of Solihull and 40% of Birmingham residents live in the most deprived communities in Britain, with 1 in 3 children living in poverty. We need to play our part in eradicating this by focusing on all the factors that impact on people's health, not just caring for them when they get sick.
Our new integrated care system will be driven by our overriding objective to be ambitious, to take this opportunity, the biggest in a generation, to rethink health and social care, to make Birmingham and Solihull the healthiest place to live and work, driving equity in life chances and health outcomes for everyone. We can't do any of this without the right people with the right priorities and passion to lead. If this sounds like an opportunity that inspires you, then we'd love to hear from you.